We're now going to show you some pathological conditions that affect the aorta and the pulmonary arteries, particularly pulmonary thromboembolism and dissecting hematomas of the thoracic aorta. Patients with acute retrosternal chest pain, the pain may be related not only to ischemic heart disease, but to other conditions such as pericarditis, massive pulmonary embolism, and dissecting hematomas of the aorta. Computed tomography is an ideal modality to demonstrate these pathological processes. In the next two images, one can see a patient with a right pulmonary embolus. And in the second one, on magnetic resonance imaging, we can see the signal drop from the presence of a thrombus in the right pulmonary artery. Both are examples of massive pulmonary embolism. Both CT and MRI are modalities that can demonstrate pulmonary emboli, particularly in the central portion of the lungs or within the heart. Dissecting hematomas of the thoracic aorta can be classified into a type 1 and a type 2, or a surgically treatable and a medically treatable form of dissecting hematoma. The first two images revealed a high signal at the level of the ascending aorta. The first one close to the aortic valve, the second one extending to the origin of the brachiocephalic arteries. In the second image, one can see that there is a hematoma in the pericardial sac due to rupture of the ascending aorta. So the two cases are examples of a type 1 of dissection that should be treated surgically. The third image is of a dissecting hematoma type B, or the one that is treated medically, and note that it affects the entire length of the descending aorta. The high signal represents blood in the false lumen, but occasionally stagnation of blood can produce a similar finding. These are three examples of dissecting hematomas studied with magnetic resonance imaging. These are two CT cross-sections of a patient who had a dissecting hematoma type 1. Note the enlarged aorta, and note the radiolucencies that are seen traversing the lumen of the aorta. Note on the second image that the intimal flaps extend throughout the arch of the aorta into the descending aorta. In these two CT sections of a patient with dissecting hematoma, one can see the narrowing of the true lumen with the intramural hematoma that is not opacified. In the picture to your right, one can see the double lumen, where the true lumen is narrower than normal, and the false lumen has a lower density, which was related to the hematoma in the lateral wall of the descending aorta. This is an aortogram of a patient with a dissecting hematoma type 2. Note the narrowing of the proximal descending aorta with some of the contrast in the false lumen. And the next one is a diagram of the type 2 dissection, which usually starts distal to the left subclavian artery. One of the complications of a dissecting hematoma is a hemopericardium, which is illustrated in this cross-section of the heart. Note the ventral thickening of the pericardial sac due to the hematoma, which arose from the ascending aorta. When CT does not stop at the level of the chest but extends into the upper abdomen, one can show sometimes aortic aneurysms, as seen in this patient who had a large aneurysm with a mural hematoma below the diaphragm.